Hi, it's Vince here in Brussels. Thanks for joining us again for our third and final session today of the Universal Health Coverage Pavilion from Devex. Our next session is harnessing the power of data and digital technology for health transformation in the COVID-19 recovery. And I am thrilled to introduce Catherine Cheney, our Devex correspondent on the West Coast of the US. And Catherine and I often talk by Slack, but it's rare we have the pleasure of actually speaking one-on-one. Catherine, how are you doing? And what can you tell us about today's conversation?
Thanks, Vince. I'm doing great. It's early morning here in California, but really excited to have this conversation. I, in fact, moderated a similar conversation this time last year in New York when we were all in person for the UN General Assembly. And we were asking similar questions. How can we take these advancements in digital health tools and ensure that they're solutions for everyone? How can we take, data, digital technology, we're seeing all kinds of advancements, but ensure that it really helps us deliver on universal health coverage to the last mile. And so we discussed last year how, of course, we have to go beyond technology. It's about the right regulatory environment and public-private partnerships and human-centered design. What's changed between last year and this year, as has changed so many conversations, is COVID-19, which has, of course, accelerated the use of digital health. And yet we're still pretty behind when it comes to reaching everyone and ensuring everyone sees the benefits of those digital health solutions.
Now, I spied a speaker on your program who I spoke to recently for a story, Naveen Rao from the Rockefeller Foundation, who's just started a commission through the WHO on the social determinants of health. And when he and I spoke a few weeks ago now, I was pressing him on the question of data privacy, which I think is something that's front of mind for a lot of people as well, especially when we think about contact tracing and the kind of what's possible basically with our phones. I imagine that'll feature as well at some point in the conversation today.
Absolutely. So, data brings huge potential for digital health, but also raises a lot of questions, some of them big concerns. And so that'll definitely be among my questions. I have it geared up for Naveen here. We're definitely going to talk about data privacy, but I would also encourage participants, and we'll get to this, but to use the Q&A function that you'll see on your screens to ask your questions, because I assume many of you are grappling with big questions around both the potential, but also some of the major concerns around data in your day-to-day work. And we'd love to talk about that.
That's a great point, and I just second that with our audience. Find us on social media, on LinkedIn, on Twitter, and please pose your questions all throughout the event, and we'll be happy to get them to our panelists as well. I'm really excited about this event because I have get to kind of dip in and out of data issues in my role in Brussels, but Catherine's really the pro on all of these questions. So they're talking you up, no pressure. And now it's 4:30 in Brussels. So with that, I'll hand over to you for today's panel. Thanks.
Thanks so much, Vince. I really appreciate it. And want to thank you all for joining us for this important conversation on harnessing the power of data and digital technology for health transformation in the COVID-19 recovery. As I mentioned, I had the pleasure of moderating a similar conversation, posing some similar questions this time last year at UNGA. Of course, the landscape has changed, largely due to COVID-19. And I think a lot of what we're going to be talking about today is how do we seize this moment and ensure that many of the health solutions, digitally powered, data-enabled health solutions we're seeing during this COVID-19 crisis actually can help deliver on universal health coverage in the long term. So again, as you heard, I'm a senior reporter for Devex. I'll be your moderator. I'll be introducing our other panelists in just a moment. But just to kind of set the scene here, we all know that, as we've discussed just now with Vince, data and digital technologies offer tremendous promise when it comes to reducing costs and expanding global access to healthcare. But due to a range of factors that I'm sure you are all familiar with in your day-to-day work, these tools are not delivering on their potential at scale. And that's because despite some incredible advancements in technology, we have challenges when it comes to delivering on potential in low and middle income countries, and half the global population still lacks access to primary health care. So the COVID-19 pandemic, as you all know, really highlighted the potential of these technologies to expand access to care, as well as the urgency for digital transformation in low and middle income countries. So this week, as leaders are gathering virtually, as we all are, for the UN General Assembly, it's really critical we discuss, as I mentioned earlier, how do we seize this moment? How do we make sure that digital health tools can help achieve universal health coverage by 2030? Part of what's exciting about this event is Devex is putting this on in partnership with some coalitions that can really move the needle. So there are real opportunities for you all to not just discuss the issues today, but hopefully actually get involved. This is just one of a series of events we're hosting at this year's virtual UHC Pavilion, which Vince has been leading you through today from wherever you're dialing in from all over the world. You can find more information on the Devex at UNGA75 site, unga75.devex.com. So I mentioned we have a couple partners today who are working on exactly the question we're discussing. This event is hosted in partnership with Transform Health and the Digital Connected Care Coalition, or DCCC. You'll hear us say that a lot today. These are examples of a growing number of efforts that are working to support the digital transformation of health systems in low and middle income countries. So you'll hear about those efforts and more from our experts and practitioners joining us today. First, just a couple quick additional housekeeping notes. As I mentioned, we would love your questions, and we're actually going to introduce audience Q&A throughout our session today. So don't wait for me. Go ahead and dive in and ask your questions. If you're on mobile, you'll see that just below the video, and if you're on your computer, you'll see that to the right. Throw those questions in there, and I'm going to bring them up throughout. I also wanted to note that this session is being recorded, so we will get in touch with all of you with a link to that recording. And we're going to integrate 2 polls that we'd love for you to vote on. You'll see them right next to the chat that I just mentioned, so would love for you to interact and answer those questions when that time comes. And if you're active on social media, lastly, Vince mentioned social media, be sure to share your takeaways there and tag Devex and use the hashtags UNGA75 and hashtag digital health. So without further delay, I'd like to introduce my first panel, and I'll briefly introduce our speakers, then ask them each to respond to the same question, really, sort of a scene-setting question before we dive in further. So Dr. Anurag Agrawal is co-chair of the Governing Health Futures 2030 Commission, which is a joint commission of The Lancet and the Financial Times exploring the convergence of digital health, artificial intelligence, and other frontier technologies with universal health coverage. Dr. Naveen Rao is Senior Vice President of the Health Initiative at the Rockefeller Foundation. You heard a little bit about him earlier in a preview of a question I might be asking him related to data privacy. Kala GV is head of the Philips Innovation Campus in Bengaluru, India. And Dr. Saban Sanzimana is Director General of the Rwanda Biomedical Center. As we hear from our experts, we really want to get a read of the room as well. So if you'll go ahead and check out the poll you'll see popping up, the question I have for you all, and I'll quickly do a round robin of our panelists just to kind of get us all on the same page before we dive in further, is what is the biggest barrier to digital transformation in low and middle income countries? And the options you'll see is implementation remains fragmented, there is a lack of infrastructure and connectivity, or there's a lack of financing and resources. I don't know if we have an all of the above option, perhaps we should, but if you could pick what is the biggest barrier to digital transformation in low and middle income countries. And I'm just gonna quickly go to each of our panelists and get, what would you answer in that poll? Or if you wanna fill in option D, that's fine, before we dive in further. So Dr. Agrawal, do you wanna jump in? What is the biggest barrier? We'll start with challenges, then move to opportunities. Oh, and you're on mute. No problem.
Infrastructure, I think, would be the biggest one for the time being when you look all across the low middle income domain.
Perfect rapid fire answer. We'll come back to dive deeper. Naveen, what is your answer there? What do you think is the biggest barrier?
To me, the biggest barrier is the lack of communication between the 3 sectors, the government, the public, and the private, and specifically between the public and the private and the government and the private. There is this mistrust. We don't speak the private sector language, but unless we bring them into the conversation, we are not going to get the solutions. They have the solutions, but we expect them to give it to us, and we have the need, and we expect them to fill it, but we don't speak their language. We need to give them the incentives, regulations, and set the playing field, taxes, whatever levers we need to pull to bring the private sector in. That is the biggest barrier right now, the mistrust, lack of communication.
Great articulation of the barrier and part of the way forward as well. And Kala, what do you think?
I would say both of them. One is the infrastructure, okay, especially when you go into these countries where access is very difficult. So infrastructure is one of the biggest barriers. And at the same time, if we have to make this happen, okay, at a scale, it is important for all the stakeholders to come together, trust each other, and it is all about the ecosystems play. That's what I would say.
I couldn't agree more with that. And finally, Dr. Saban, what do you think is the biggest challenge or barrier we face here?
I'll probably have a different view in terms of what we need and what we should be doing. To me, the main challenge is believing that this is the investment we should do. And sometimes it's important to see that what is ahead of us needs to be driven by technology. So if we believe that we can do it and this is a priority, to me, this is the biggest gap. And we need to invest in our leadership, our community, our private sector to understand that this is a priority. It's not a choice. It's not something you need to leave behind. So to me, this is the main barrier, the main thing we need to understand to move forward.
Thank you for that. And I just want to note, we do have some results coming in from the poll. So I want to share what it seems like our attendees are thinking in terms of the biggest barriers. We're about half and half here in terms of 40% of our participants think implementation remains fragmented. That is our large challenge. 44% think it's the lack of infrastructure and connectivity. And then just 16% are chiming in that it's the lack of financing and resources. So we will get into the way forward through the remainder of this panel, but I'm really grateful just to get a read of the room and the take of our panelists. So Dr. Agrawal, I'd like to start with a question for you. And I mentioned earlier that the COVID-19 pandemic has exposed a lot of the opportunities when it comes to digital health. But I'd love to hear from you, what are those specific opportunities? Telemedicine being one of them, certainly, but what are the opportunities the pandemic has exposed, and how can we build on this momentum to ensure that it isn't lost?
Sure. So, COVID-19, the biggest driver for digital health is fear. Normally, people like face-to-face care. Face-to-face care is the front door to health services, and digital health has always been like a side door. You go there when the front door is locked, you go there in the middle of the night, you go there if there is nothing else. I think for the first time in a very long time, digital health became the front door of getting medical care. And telemedicine's been around forever. If I take India in 2000, we were using satellites to serve villages by private companies. But it never grew. But within a short time of the starting, acts got passed, rules got cleared, and in fact, what Naveen was talking about, people got their act together. And the infrastructure challenges, of course, remain. So not everybody could access it, but more and more people bought into the belief. And we actually believed it can be done. Doctors who thought it would never be done actually feared healthcare providers were the most affected people. So they wanted to make the transition. And that to me was the biggest thing that COVID-19 brought together. It brought together consensus of various parties, usually at odds with each other, but for once in their lives, they all believed it must happen. I'll stop there.
Thank you. I appreciate that answer. And I wonder, once fear has subsided, once, there's a vaccine and we have a plan, it really is that challenge of momentum, keeping the momentum up to ensure that we continue to advance in these tools and that everyone can benefit. So that brings me to a question for Dr. Rao. So Naveen, if you could talk with us about, as I mentioned earlier, the COVID-19 pandemic not only highlighted incredible use cases and continues to highlight incredible use cases for digital health, but it also highlights the urgent need for digital transformation. So can you talk about what have we learned about this need for digital transformation and ways that these digital tools can contribute to broader UHC goals? I think this is discussed often at UNGA. It's not just about the tech, but what have we learned in the pandemic?
So there is a saying that a crisis is a terrible thing to waste. And while we're going through the crisis and we're literally suffering through it as a global community, it is showing us opportunities of how we can build back better, build back stronger, and make sure that the inequities that this pandemic has exposed, uh, uh, systemic inequities across all lines that this pandemic is exposed, is something we take into consideration as we go forward. So for me, the opportunity here of what data and data science and digital tools can bring to the field is that it has this veneer of being able to bring an equality, whereas data is not biased. Data by itself is not biased, and if we set it right, the platforms, we can actually ensure equity in all what we do. Let me give you an example. When we were working in Uganda, when the lockdown happened, we realized that there were two problems. One is that the essential services were being denied, and actually, the people are now saying in 25 weeks of this pandemic, we've gone back 25 years in TB, malaria, HIV, all the other things that we had gained progress. We've negated 25 years worth of progress in 25 weeks. So there was that, but there was also data gaps. We didn't know where the essential services were not happening. So we helped the Ugandan government set up a one-stop shop, a data hub, that not only was able to tell us where these essential services were not happening, but also what do we need to do, working with community health workers, giving them data and digital tools because they can't go house to house anymore, that we were able to come up with this data hub that not only allows us to deal with the pandemic now, but we feel the structure and the rails we've set is on which the trains of the future will run for public health towards UHC. Excuse me. Excuse me. So this is the value proposition that a pandemic can bring to us, allow us to build back better, build back stronger, set the rails for the future trains for public health. And now is the time, and data technology allows us that chance.
Thanks for that. And I did want to ask you one follow-up. I know one of the many efforts in terms of taking these tools and helping them actually realize their potential is the 3D Commission. So can you just tell us a little bit more about the 3D Commission?
Yeah, so the 3D Commission, basically the 3Ds of the 3D Commission stand for determinants, which is the social determinants of health, the data, the people who are responsible for the data and collection in the dashboards, and then the decision makers. We realized that everybody understood that health versus healthcare. Healthcare is hospitals, doctors, medicine. And health is everything else. We confabulate the two. We presume when we're talking health, we keep going to healthcare. But that's only 25% of your health depends on hospitals, doctors, medicine. 75 depends on where you live, the food you eat, the air you breathe, the violence you're exposed to. Most of the investments and the shiny toys are in healthcare, even though it's only 25%, 90 to 95% of all investments go in that sector. And we realize that the social determinants are neglected till it becomes too late. So we said, can we bring the 3Ds together? Can we bring the data, the decision makers, the determinants people who each live in their own universe to come together and work together? So the analogy that comes to my mind is we're getting better and better at fishing bodies out of the river, but we need to ask ourselves, who's throwing them in? And unless we go upstream and work with the social determinants, and we're never going to be able to catch up with fishing bodies out of the water. So we established this to try to come together to bring precision public health to the fore. And how can we make sure we're dealing with health and not just focusing on healthcare, which is actually too late.
Then one last question for you, and I'll give you a break. But Vince mentioned data privacy, and I wonder, how does that factor into your work at the Rockefeller Foundation, your work with the 3D Commission? And I want to ask Kala a similar question, so it'll help us transition to that as well. But can you tell us, obviously we all know there are concerns when it comes to data privacy. It's probably discussed year after year. Anything new due to the COVID-19 pandemic we should be thinking about?
Yes. So the pandemic has shown us that data privacy and shying away from bringing data and data science to public health is a false choice. So on one hand, there is the need for data to be able to protect the public. On the other hand, there is the need to protect the privacy of the individual. So there's a collective and there's an individual. And right now, it seems like if we are focused on the collective, we are going to jeopardize the individual. And if we are focused on the individual, we are not able to do complete justice to the society. But that's a false choice. If you look, and I'd like to articulate it two ways. One is what technology has done. Technology, there is technology that exists today, and we use it, by the way. We already use it when we do our banking. Even when we order pizza, we tell the pizza, we give them our credit card and we give them our home address. And that's a whole lot of privacy there between our credit card and our home address. But for that pizza, we are willing to do it. There is banking. You do your banking online, and there's a whole lot of information that goes out there. Even when you're driving on the road and you have logged into Waze, you're telling Waze where you are, where you're traveling to, all that information you're uploading, but you're getting something in return, which is it's telling you what the road conditions are. So it's a balance between benefits and risks, and there is technology to anonymize data. We don't need private individual data to come up with public health insights. So this data technology is one aspect that is already in place and other industries are doing it and we need to learn. And the other aspect is this understanding that unless we get the data, we are going to be flying blind. So we need to deal with this privacy. We need to be able to get the private sector in, the governments in. We need to bridge this trust divide, and we need to find technology that will allow us to anonymize individual data so that we can still get the insights for the collective without jeopardizing the individual. And it can be done. It has been done in other industries. We just need to get beyond it on the health side.
Absolutely. And I'm glad I asked you that question because I could see Kala nodding in front of the image of her offices. Looks like you're right there. I wanted to ask you, Kala, pretty much the same question here, but maybe you can share some specific examples that you're seeing in your context. How can we ensure that these technologies are scaled to benefit millions and those who are not currently benefiting, but also take into account privacy and ethical concerns, which, as Naveen said, there's a risk-benefit calculus there, but there are still some concerns to sort through.
Yes. So I think Dr. Naveen covered most of it. Okay, there are other industries which has gone much further with this. Okay, especially if you look at the banking industries, what Dr. Naveen alluded to is very true. There is something for us to learn, right? And now we are moving towards telehealth, we are moving towards faster diagnosis, etc. It becomes very evident that we have to get these insights, right? We talk about technologies where we are learning from the data, the insights. We are talking about artificial intelligence. We are talking about so many things which is going to help or which is going to enable the care providers to take the decision faster and then provide the right care at the right time. So it's extremely important that we balance between how we are using the data. And there are technologies. There is a lot of focus, especially when it comes to healthcare. There is a lot of focus on the privacy and the security of data. And if you take examples of Philips itself, we have a big team which is focusing on this. And they are keeping track of what is happening in the world, what are the security issues that are coming in, how can we take care of those proactively, and what are some of the things. These are being the advisors, the top consultants who will come sit with us while designing the solutions and help us to use the right, I would say, protocols in order to deliver the solutions. So overall, I think it is always good to make it as a very important topic. Okay, we have to be careful about the security, privacy, etc. But as Dr. Naveen said, there is a technology which is going to anonymize the data. And it is extremely important all of us understand those technologies and aid the right data industrialization, which is going to help us to drive the right insights and also the AI to help the care providers to move faster.
Thanks so much for that. I wanted to follow up with you. You bring a very critical perspective coming from the private sector. And of course, the private sector plays a huge role here. And that's something Naveen mentioned as well. I'm curious if you can expand on what are the opportunities for the private sector to turn some of these often siloed solutions into real solutions that can deliver on universal health coverage. What are some of the opportunities, but also what are some of the real challenges? What needs to change for us to go from these siloed technologies to real cooperation?
Thank you. Thank you very much. So first of all, the private sector can help accelerate the digital transformation. You may ask me how? Because we have the capabilities and the expertise. For instance, it needs an R&D, it needs operation. Just now we talked about data scientists, etc. We need them. We need sales, marketing, legal, everybody to come together in order to design and deliver the solution. Apart from this, the private sector can play an important role in funding and also in its multiple solution architecture. Now, if you look at the UHC, okay, what is the private sector constituency there? It calls for creation, adoption, applying, and then also scaling up this innovation. Not only innovation, but also how do you develop new innovative business model, which will fit the different aspects, the different segments. Apart from this, there is a need for us to strengthen the capabilities of the health workforce, because again, as I told, it is all about ecosystems. So this is where the private sector can help the health workers and build the capabilities so that they can have the relevant policy dialogue with the partnerships, with the government and the other stakeholders. Now, if you look at the WHO and the ITU framework, it asks for the private sector to provide value in certain areas. One of the three of them I can think of. One is the service and application, the infrastructure, and also the strategy and investment. Now, you asked me for an example. Let me take an example. Like, I represent Philips Innovation Campus. When you introduced me, you said I'm head of PIC Bangalore. This is the place, this is one of the innovation centers where we have all the cross-functional teams coming together. This has the engineering development teams, the Q&R, that is the regulatory specialists, the privacy officers, and we have verification engineers, and I can go so on. So we work together not only within our hub, but also across other innovation hubs, like for instance, Nairobi, Cambridge, we have other hubs. We work with them and to design locally relevant digital innovations. Now, if you have to take an example, okay, I'll take an example of the private sector providing value, especially in the digital service and application. So this is a solution where we look at the first 1,000 days of life of a newborn and a mother. This solution follows the mother and the babies during the pregnancy and post-birth. So during this journey, the mothers are scanned using the handheld. It is called the Lumify. It's an ultrasound device. And the progress of that is captured in a mobile app. That is the mobile obstetrics monitoring. We call it MOM. And this app digitizes the antenatal and postnatal care journey. With the clinical decision support, we are able to identify the high-risk pregnancies. Okay, so you may ask me, like, this is theory. Did you do a pilot? Of course, we did a study. We did a study of 5,170 mothers in a place called Shorapur in India, where there were high-risk pregnancies, and there was maternal and infant risks. Okay, we used this application, the MOM solution, which helped us identify the detection of the high-risk pregnancies by 3x. It increased the early referral. Once we detect that, the high-risk pregnancies, we need to refer them to the right centers for their care. This improved by 2.5x. And finally, the result is 0 maternal death. So this is what has happened out of this trial. I have many more examples, but hope this answered your question.
Yes, very helpful. And I think it hits home for me when you bring up maternal and child health. That's a great example of how, women who have access to connectivity, access to affordable devices can benefit from technologies like this. And technologies like this are so crucial during this COVID-19 pandemic, when you're not necessarily going to be able to go to a facility if you're having a problem, and yet women who don't have access to connectivity or affordable devices are in the dark, and perhaps unable to access a healthcare facility. And as someone who had a baby earlier this year and knows about all the uncertainty and all the things that can come up in a pregnancy, and especially in lower resource settings, I just think it's a really great example. I'm glad you brought it up. So speaking of making sure that there is not only advancements in digital tools, but actually the digital infrastructure that allows everyone to benefit, I actually want to go to Dr. Saban and hear a little bit from the Rwandan context. So as many of us know, healthcare in Rwanda has changed dramatically in the last 10 years. And I'd love for you to tell us a little bit more about that transformation and the role that digital technology has played.
But thank you very much. And I'm actually enjoying this discussion from different experiences and colleagues on this panel. So I'll probably take you back the 20 years in Rwanda, because there was no health system per se, because what has been built had completely collapsed during the genocide against the Tutsi in 1994. And what has been done in the past 20 years, 26 years, has been to rebuild a health system from scratch. And what we have seen is a quick transformation that has helped to save a lot of lives, not only in locations or a few districts, but nationally. And that has been, of course, a challenge, but also an opportunity to build a health system that comprise all the existing or the current considerations and programs, and probably mention a few indicators, as my colleague just mentioned, maternal child health being one of the priorities to ensure that the health system really works. So in the past 10 years or so, we've seen a reduction of maternal and child health up to 77%. And this is, for us, not the target, for sure, because every single life counts, and going to zero is the best you can do. But also there are other diseases like HIV, malaria, tuberculosis, and other infectious diseases that are very frequent in our region. HIV probably is a good example, because it has been affecting different sectors and people's lives. So in the past 20 years, we've seen 82% reduction of AIDS-related mortality in Rwanda. And if I mention HIV, is because in the tragic history also, HIV has been used as a weapon of war to cause maximum pain to a lot of people, including mothers, including children and families. So seeing that this is a quick reduction, not only HIV, tuberculosis as well, malaria, although it's not yet out of our priorities, but still vaccination, for example, we've been maintaining 95% of vaccination of children who are vaccinated, the different vaccines. And of course, all these can be better measured with life expectancies of people. That has almost doubled in the past 10 years, from around 40 just after genocide, 67 currently. I mean, it's not like we've achieved what we want to achieve, but this quick transformation has been noted, and it's a motivation to do even more with two things. One, geographical accessibility to healthcare. Whoever with any cost, I mean, financial accessibility is really, really important, and also building a health system that can be ready for any challenge, including COVID-19, as we say, and most importantly, technology and innovations, and using the best science to simplify people's lives and improve. Probably this is also a focus for this discussion.
Thank you so much for that. And I want to come back to you in a moment. But first, I'd actually like to return to Anurag, if you don't mind, because we heard earlier about some of the efforts to connect the dots, to bring the parties that need to come together. And I know that the Governing Health Futures 2030 Commission, which we previewed a little bit earlier, is working to do some of that. So can you tell us more about that effort, and how does that fit into a larger context of ecosystem efforts, if you will, that are trying to get at some of the dynamics we've just been covering?
Thanks, Catherine. I mean, in fact, a lot of it boils down to something that Naveen said. We're almost in the business of fishing dead bodies out of the water when we know the problem is upstream. So when you start thinking of digital health, all things digital, you have to remember it's about health at the end of the day. You can digitize things, you can make them with all fancy, algorithms and so on. But the reality is, the reason the trust is lacking is because you don't know that these things will work in achieving what you really want. A healthier society, healthcare for everybody, and these principles are not ingrained into emerging technologies. So fundamentally, you need better governance. You need better governance to make sure that you understand what it is that you want. What are the paths you will take to get there? Are these paths truly in the direction that you stated, or are they veering off 90 degrees to the right, increase in inequities? And importantly, do they actually work? In fact, in the last 6 months, my institute being one of the regulatory institutes for all digital tools in India, we have seen a huge amount of pressure. People come out with an algorithm that detects COVID or SARS-CoV-2 positivity on a chest X-ray, and everybody up to the minister is calling, why is it not approved yesterday? And you actually run it, it doesn't quite work that way. And you look at the use case scenario, the use case scenario is absolutely flawed. You would do more damage by getting these solutions out than by reining them in. So what is the role of a regulator? What is the role of governance become tough questions. And COVID-19 forced us to ask many tough questions of ourselves. For me, real hands-on experience in the last 6 months. What are these technologies for? What are they truly capable of? Will the application of technologies actually increase inequity or actually provide solutions? And who will determine it? Will it be bureaucrats? Will it be technocrats? Shall we trust the industry with it? Shall the industry trust us with their algorithms and allow us to make determinations for them? I think trust has come out to be a major, major issue. Fear, for the time being, has patched together all differences. But I'm afraid that when all this fear goes away, all these cracks that we are papering over temporarily will come back. And I hope we don't do things in the last few months that will increase the distrust in time to come. So these are the challenges the Commission is faced with broadly and specifically.
Such powerful points. I mean, when we were having a related conversation this time last year in terms of what's needed, I never thought of fear as the driver that would advance a lot of change. But then what happens when that fear goes away? We have some great questions coming in from the audience, so I want to make sure to get to those. Please feel free to keep them coming, and I'll direct them to the speakers. This first question I'd love to direct to Dr. Saban, actually. This attendee would like to hear specifically how digital health tools were used when it comes to COVID-19. Detection, monitoring virus spread, surveillance, tracking impact, mitigation, disease modeling. So I'd love to hear, in Rwanda, how are we seeing these digital health tools applied right now in crisis mode, and especially when the lockdowns were most intense?
Thank you. This is an interesting question. I would say that probably COVID-19 has been one of the fastest or the main trigger or pusher to embrace technology we've ever had in Rwanda, and I believe in many other countries. What we observed is that after we got the first case of COVID-19 March this year, everyone was thinking, how are we going to monitor, to trace, to report, to intervene, to collect sample, and actually to reach to the far rural village to make sure what we are doing is monitored in real time. And that is where you see the importance of technology, digitization. You need really tools that will tell you this information. So a few examples maybe to cut the story short. From the sample collection in the testing, we implemented quickly a system that once you collect the sample, we're collecting thousands of samples a day, you bring it to the lab, you test it, then you return a result. You don't go into papers or report or follow up on 5,000 calls to get the results. So we build a system that we trace the sample from the collection point to the return of results into mobile phone for the client. And this is something we did over maybe five days, and didn't come from something we planned before, but it happened. I'll say that this is how people really think quickly in the cases of pandemic and the other situations. Another example is on how we monitor data from health facilities and respond and trace. We've had several thousand of contacts of cases who are staying home and make sure they're informed. They also alert for getting a test, and when they get a test, they receive results, as I said. And we built a system actually using the HIV program model that was existing to make sure there's a real-time contact between the command posts into COVID response and the client in their households. And this system still works, and is an exchange of messages and the calls, and whenever there is an urgent information is provided. Maybe another key example that comes in my mind is also in the area of how in COVID management, we make sure doctors and nurses are not infected massively, because this is a main risk. They're facing the virus, and they're facing people who have the virus. So we had to bring in like doctors who will not be infected, and these are robots that are brought in Rwanda in early May this year. These robots are helping doctors to keep medical records, medical informations. And instead of doctors going in their rounds several times, they can actually follow patients from a distance and visit fewer times, as well as those who are serving food and water in the patient wards. We've used the drones to transport samples from remote areas in our laboratory centers. So there are several examples, but we've seen a quick transformation, quick use of technology and data and digitization in the process of COVID-19 response. And we are still seeing, whenever we see a challenge, we think on how we can address it from easing the way we do it.
Thanks so much for that. I've done some reporting lately on the use of technology in the COVID-19 response, and Rwanda always comes up as a use case and a great example to take a look at. So I appreciate getting some of your insights. Another question that's come in, and I'd actually love to do another rapid fire here as we're nearing the end of our panel and just hear from each of you. I think it's a great question, although I'm going to reframe it a little bit away from a yes or no question. The question is, can the panelists confidently say that low and middle income countries are no longer subject to the pilotitis that ends up feeding the development of digital health tools? I assume we would all say pilotitis is still a problem. So rather than phrase it as a yes or no question, I'm going to reframe it a little bit. Great question. What I would ask is, how do we ensure that as we move forward from the COVID-19 pandemic, pilotitis does not continue? Because it's been a very real problem. And now we're faced with a real crisis where that's not acceptable. But really, it shouldn't be acceptable across many global health priorities. So how do we actually move forward in a way where pilotitis does not continue to be a problem in these contexts? Would love to just go rapid fire on that. Dr. Agrawal, did you want to jump in?
Yeah, absolutely. I think the only way out is to have a blueprint and to have a mission. So for example, in India, the National Digital Health Blueprint in 2019 has now been approved and announced by the Prime Minister as a National Digital Health Mission. One of the silver linings about COVID that I can see, and it's a full document that presents a clear vision, getting us away from the problem of multiple people doing multiple pilots everywhere. It'll still happen. It'll just be less.
So at least we'll mitigate the problem somewhat. That's a great answer.
Yeah.
Dr. Rao, it looked like you were unmuting, wanting to chime in. Do you want to go next?
Okay, sorry. Yes, I'm going to take a contrarian view. No major advance on science happened without a pilot. Okay, if you look at it that way, the story goes that Edison tested over 1,000 filaments And so that's 999 failures before he came with, and he kept at it. So by definition, progress doesn't happen unless there is testing, advancement, collaboration. So pilot by itself is not a bad word, and only through pilots can you get advancement in science, and it's usually incremental. And those aha moments are very few, and most often it is just a regular grind. So I don't think pilots by themselves are a bad word, and we can never get away from it. But exclusively bringing them to the lower middle income countries and doing all the pilots there, I do not agree is the right way. And also, if we have a situation where we know basically what works and it's not 100%, but 80% is good enough, we need to do that. But we can't move away from pilots if we really want to break through for new technologies, new advances. So let's not throw out the baby with the bathwater here.
I really appreciate that distinction, the importance of pilots, but let's make sure that the pilots do ultimately go to scale if they're working, right? Did you want to jump in there, Kala?
Yes. So I feel that it's very important to understand the needs of the customers, consumers that we are serving. Pilot is one way, because initially when you start designing a solution, you go and then get the inputs from there. After that, without running the pilot, we do not know whether we have met the needs and we have resolved all the pain points that we listen to. So I think we cannot go away from pilots. And this is going to help us, to get the right inputs. But again, once we do that, coalitions like this is going to bring all of us together to see how we can remove the redundancy and take this pilot from being a pilot to scale. So alluding to what Anurag said, I think all the stakeholders has to come together where we need the digital footprint and where we need some of the governances and everybody to come together to bring it to scale.
Thanks for that. And finally, Dr. Saban, you mentioned drones in Rwanda. Of course, Zipline, based out here in California, is doing some amazing work with drones where you are in Rwanda. And of course, that involved a lot of pilots, and I'm sure they're still piloting all the time. But you've probably also seen lots of digital health solutions that are pilots that never ultimately deliver. So how do we prevent that dynamic?
Thank you. Probably starting with something we've been using as a slogan here in the health sector in Rwanda, that when you do pilots and repeat piloting for a long period of time, we would say pilots are actually better preferred in the airlines and not in the implementation of the health programs in Rwanda. But I want to emphasize that all pilots are not that delaying or implementation. Some piloting projects are important if they are designed to prove the concept in a very fast way and without trying if access of water is important or not. And you see that there is a need of water. Why do you do a 5-year pilot projects for that? It's a balance of what type of pilot projects you need to do quickly, and then you continue. It's not a pilot to finish and go. It's a phased approach of implementation. This is how we see it. And it's important to balance this and understanding the urgency of doing something good. If it works, why do you continue to pilot and try again if lives are waiting to be saved?
Powerful answer. Thank you for that. Before we move into our fireside chat to learn about some initiatives that can help move this forward, I just have a closing question before I thank our panelists, actually for Dr. Agarwal. So you mentioned to us what you're working on with the Governing Health Futures 2030 Commission. And I'm curious, we're about to hear a little bit more about Transform Health and DCCC. How can initiatives like this carry forward your recommendations?
I think it's, as Naveen indicated, and Kala also indicated, and I think Sabine said the same thing. It's about building partnerships. And if you want better governance, you need to know who makes the rules, who is being governed, how to find lean and balanced points within the governance systems, and getting multiple stakeholders together and getting their views in to minimize conflicts of interest is really the way. And all these coalitions that are being built together show us that. I mean, each person provides a different facet of information. Some tend to be more tech-oriented, some tend to be more people-oriented, some tend to be more economy-oriented. And that's very important. As Naveen said, you ultimately have to find the money to deploy the infrastructure, because when I was pointing out infrastructure is a limitation, well, somebody has to put in the money to build the infrastructure. And that somebody has to find sustainability. So rather than slogans, you need understanding. And that's what I think is really important through fora like this. And UNGA is a great place for these discussions, and Devex as well.
Thank you so much. Well, great way to tee up our next conversation. So usually if we were all together, I would say, please join me in thanking our panelists. So hopefully everyone around the world will do a light applause, or a heavy applause for our fantastic panelists. But thank you all so much. Really appreciate it. And now we'll transition into our next conversation, which relates to a poll. I really appreciated seeing answers on that earlier poll. So you'll all see another poll. I'd love for you to go ahead and chime in as we transition to this next conversation. And this question is, how can digital technologies have the most impact? Is it by improving the quality of care, by reducing costs and expanding access to care, or by improving efficiency? And I already see some answers trickling in, but I'll give others who haven't had the chance a moment to fill out their response so that we have a more fair representation and take a read of the room here. So earlier I mentioned Transform Health and the Digital Connected Care Coalition, which you're going to hear a little bit more about. And in preparing for this session, I was reading some of their materials, which really framed how digital transformation for universal health coverage, exactly what we're discussing today, is a goal within reach. And in this panel, we're going to discuss, all right, how do we do it, essentially? So you're going to learn more about their work and opportunities to get involved. And I'll briefly introduce our panelists. You'll hear more about their work as they respond to some of our questions here. But first, it's my pleasure to introduce Dickie Settle, who's the co-chair of Transform Health. He's also a commissioner at the Lancet Financial Times Governing Health Futures 2030 Commission, which you just heard a little bit about. And he's the chief digital officer at PATH here on the West Coast in Seattle, as well as director of the Center of Digital and Data Excellence at PATH. We also have Nicole Speaker. She is the director for East Africa at Farm Access Foundation. And today she's here on behalf of the DCCC. So she'll be telling us a little bit more about their work. And finally, we have Danielle Mullings. She's the Caribbean and America's Young Expert at Tech for Health, which is part of Transform Health. And we'll be bringing her perspective to this conversation. So thrilled to have you all. Thank you so much. I'd love to start with Dickie. So Dickie, can you talk with us about, we mentioned earlier that there are a number of ecosystem efforts, and I want to understand what was the void that Transform Health saw, and how does it really try to add to those existing efforts?
Thank you very much, Catherine. So happy to be here today. Okay, so there have been many wonderful collaboratives in digital health. I think I've talked about them on previous Devex events, and they've been really rich and powerful for coming together and aligning to address some of the fragmentation and pilotitis that you talked about earlier. Really aligning around open standards and approaches for interoperability and convergence around global goods. These technical collaboratives have been extremely powerful. However, in many ways, they're conversations between technocrats, between technology developers, between implementers, between different technical experts who are really looking at how to advance digital transformation. And they often, when they go to work in countries and support countries, are engaging with technocrats themselves, digital and data experts in ministries. And when you work with these digital and data experts, it becomes really clear they have a fantastic vision for what digital and data technologies can do for their countries. However, they rarely have the mandate in some ways to really to implement these changes and that transformation. And really what the gap is we don't quite have the committed leadership and the full understanding of political leadership to be able to make the commitments and the financial investments and to really establish it as a direction for the government and for the country to put this digital transformation in place. So Transform Health was conceived as a companion to these more technical coalitions and collaboratives to really advance the political and the advocacy conversation, to engage these higher level audiences, to really close the gap in committed leadership to digital transformation that can unlock the power of everything we've heard so far today.
Thank you so much. And a great example of why Transform Health takes a very different approach is the fact that we have Danielle as part of this conversation, which I'm thrilled about. I know a big part of the Transform Health approach is to ensure that voices that might have been left out of these critical conversations are at the table. So on that note, Danielle, I'd love to hear, what do you see as the role of young people in accelerating digital health and ensuring that digital technology actually delivers on UHC? And how, beyond Transform Health, can governments and others actually ensure that youth are included?
Okay, thank you for that question. So I want to start off by saying that we have to stop treating young people as if they're only the future, because young people are the here and the now. They affect what is currently going on. And so what I like about Transform Health is that they have this intentional focus on amplifying the voices of youth and also young women. So putting those two together, I think that's a good combination moving forward. In terms of how I think governments and really all sectors can include youth more, I would say it's not just about putting a young person at the table, or it's not just about like you've created a plan already and then you go to the young person and say, well, what do you think about this plan that I've already created and I've already assessed the different options and solutions? No, young persons have to be systematically included in the design process. So it's not that you design it and then you ask, what do you think of this? It's that they're included as you are creating the process, which is what Transform Health has done. As the Young Experts Tech for Health is an independent council, but we provide that independent insight and perspectives from all 6 WHO regions across the world, as well as we have our own independent initiatives separate. But we serve as co-chairs on all the circles of Transform Health. I personally am the co-chair for the Resource and Investment Circle. And I just like that inclusion from the get-go, from the start. It's not that you've created something and then you say, oh, what do you think? No, because right now is a crucial time for young people. I see our world leaders are starting to get younger. In 2012, UNESCO said that 50.5% of the world's population is under 30. That's a major shift, or yes, a major indicator that we need to take the voice of young people and ensure that it's included in all aspects of the design process.
Fantastic. And just to quickly follow up on that, and Danielle or Dickie, whoever wants to take this, in terms of the role technology can play to make sure young people are included, I mean, here we are in a moment where we're all connected by technology. So really technology is the mechanism through which you are participating. But anything more to add in terms of the role technology can play in ensuring that, as you said, Danielle, you're systematically included?
All right, I think I'll go before Dickie then. Okay, so I think that young people are digital natives, right? And so it comes a little bit more naturally to young people because we've grown up in more of a digital world than the generations above us. And I think that's an important aspect there. I've worked with UNICEF's U-Report Youth Council, and through that, we actually have a social messaging platform, which it functions on SMS or text message, as well as it's integrated with Facebook and WhatsApp. And during the dengue outbreak last year in Jamaica, we were able to quickly inform, the 11,700 young persons that are signed up on that platform of what are the symptoms, what do you need to look out for, at what point do you need to go to a healthcare provider, as well as we collaborated with the Ministry of Health to say, okay, these are the points that young persons think that aren't being addressed during this outbreak. And then we're able to say, all right, take a data-driven approach to trying to solve some of those issues. So technology is important in providing more data. That's a huge part, so that you can make an informed solution and include the voices of young people through that.
Fantastic. Thanks so much for adding that. I want to go ahead and hand it over to Nicole here and learn a little bit more about the DCCC, and kind of returning to something we discussed earlier. We've seen the potential of digital health in the COVID-19 pandemic, but we want to ensure that some of these advancements we're seeing actually continue beyond. And so what are you all doing as a coalition to ensure that that happens? What's the approach you're taking?
Yeah, great. Thank you so much. And thank you, Danielle and Dickie, for setting the stage here about this discussion of the coalitions. The Digital Care Coalition is already constituting of more than 20 members, many of them representing the private sector. And I can tell you on behalf of the coalition, we are ready to invest in digital technology and take it to scale. We can all agree it's part of achieving universal healthcare coverage, and PPPs have to play a role. First of all, because governments in general are notoriously bad at making software investment decisions anywhere in the world. And second, by bringing private partners on board, you can also bring investors on board, which will help bring more money into the system. I think one of the key problems that we've seen up to now is that, and Vicky already alluded to it, that the policies and systems that are in place are very difficult to achieve these sort of large-scale investments. Governments and the policies that are there are used to purchasing equipment, ultrasounds, MRIs. This is how our tender processes are working, but are not used to buying software as a service instead of a solution and something that they own, which makes it extremely difficult for private sector solutions to invest at a scale that they want to. Very often, as part of the problem of pilot titers, is that they're linked to donor programs, and every donor has its favorite software solution and tech solution. And we need to help governments understand how they can choose for an architecture and continue that engagement, but also create the trust that if they bring a private sector solution on board, that they don't end up being monopolized and stuck with a solution that they can never get rid of. So it's really creating that common language that Dr. Naveen also spoke about. Now, as a coalition, we've, for example, been setting up community calls where we're bringing together these coalition partners, and we've been talking about bringing solutions to scale. Very nice example is the Reach 52 example, where we've, together with Dahlberg, we've helped set up and scale a WhatsApp solution where people can chat and communicate and ask questions about the COVID crisis, which was really, hampered with a lot of misinformation, especially in developing countries. But also from my own background, PharmAccess, our organization, has developed Safecare for COVID, which is a self-evaluation tool that helps healthcare facilities prepare for the crisis with knowledge and expertise that is now rolled out in multiple countries. So these are just a few examples of how we can get past pilot titers, go to scale, and create an ecosystem.
Thanks so much for that. And I appreciate everyone who's filled out this poll. I want to go ahead and return to the poll responses. The question was, how can digital technologies have the most impact? And the answer is by improving the quality of care, by reducing costs and expanding access to care, and by improving efficiency. We have most votes going toward by reducing costs and expanding access to care. That's 68%. And then about half and half here, 15% say by improving the quality of care, 17% say by improving efficiency. So that's just a sense of what our attendees are saying, which brings me to a question for Dickie and Nicole. You have some related aims at Transform Health and DCCC, and lots of priorities to consider. Some are listed in our poll. How do you ensure that you complement one another and coordinate the work that you're doing without duplicating efforts? Can you talk a little bit about that? And if you've learned any lessons or have any advice for others trying to collaborate in this space, would love to hear what that might be.
Great. So and maybe let me start, but then of course hand over to Dickie to add. So first of all, yes, there's a lot of choices that we can bring. We discussed together with the coalition partners about what initiatives are working and which ones are not, and which ones we should prioritize. Now, the nice thing about the two coalitions is that they work in the same ecosystem. And in fact, organizations like ourselves, PharmAccess, but also Dickie from PATH, is connecting on both coalitions so that we make sure that we align the initiatives. Now, as I mentioned a little bit before, the DCCC coalition is much more about the private sector engagement. We're looking for partners that says, hey, we have solutions, create an enabling and learning environment, develop business models for scales, and help accelerate these initiatives once they work, also via lighthouse initiatives, as we call them, to create a trusted environment so the governments know that they're investing in something that works. Related to this, the Transform Health Coalition is doing an amazing job creating an enabling environment with governments who, let's face it, are not brought up in the digital age. Daniel, if I may also quote what you were saying earlier, right? A lot of these decisions are made by the generation that wasn't born when mobile phones were around. So I think creating that voice of youth, creating an enabling environment, but also creating solutions that can be tailor-made for the realities on the ground. Now, if I can use an example for COVID, we're already seeing that the rollout of the pandemic in Africa is very different from that in Europe and the US. And yet we're using a one-size-fits-all solution, which is, these broad lockdowns, which, I'm not an expert on this, but I can tell you it's going to kill a lot more people on the African continent than COVID will. So we can't have this one-size-fits-all solution. And as initiatives and as coalitions, we're trying to create momentum for homegrown solutions that work and that can advance to scale. Now, I think I only need to mention M-Pesa as an example that was homegrown in Kenya, where I actually live myself, that has completely revolutionized how people do digital payments, and that every Kenyan is using at the moment. We as an organization are trying to do the same with Safaricom and CarePay by M-Tiba. So let's also create enabling environments that are homegrown, that are built with youth and with the cultural diversity that this planet has to offer in the background, and help governments with this enabling environment. And let me hand over to my very good colleague, Dickie, to add to this. I'm sure he has great things to say.
Thank you. Yes, Dickie, what do you have to add to that?
Thank you, Catherine. Thank you, Nicole. You talked so articulately and well about how the coalitions are working together intentionally. And it's just wonderful to see collaboratives collaborating between each other. Transform Health itself was designed as a companion coalition to the Lancet and Financial Times Commission that Anurag spoke about. And I'm a commissioner on that commission as well. And the idea there was these commissions put out these reports, and often they'll go on the shelf and not get implemented. The coalition was intentionally designed to ensure that carry forward those recommendations, make sure they get implemented, ensure that digital transformation will really contribute to universal health coverage. There's even a third part to that particular group, the International Digital Health and AI Research Collaborative, which is focused on engaging with academia. So you can see how these parts come together. Digitally Connected Care Coalition focused on the private sector, Transform Health focused on high levels of political advocacy and the global agenda, the Lancet Financial Times Commission setting that agenda with really thoughtful research and direction, and then the International Digital Health and AI Research Collaborative, or IDAR, focused on engagement with academia and helping to advance research to support low and middle income countries. All of these, in partnership with the existing global technical collaboratives I talked about earlier, begin to create this ecology, this ecosystem, a network of networks that really enable all of us to come together and address these challenges. When we talk about digital transformation, we are saying it is not just about digital health. It is about health in the digital age. And what gets bigger than that? We need everyone to come together. We need the engineers, we need the politicians, we need the private sector. We all need to bring our perspectives to that. And we most importantly need to engage the unheard voices, the youth, the women, the underrepresented population. So often these conversations happen, and we don't get to have someone like Danielle as part of that circle and really advising and guiding. And when we do that, we're missing that perspective. So as to your last point, what do we do to help people think about how to collaborate? Think about the perspectives you're missing. Help ensure you have that diversity. Help make sure you're looking for that inclusion. Make sure you're looking for that equity that will really help us come together, collectively become a whole greater than the sum of our parts, and really transform health to resolve some of the greatest challenges we're facing together around the world.
Thanks so much for that. And with that, I want to make sure to bring in Danielle again. So just a final question for each of you. Dickie mentioned, all too often these reports go on the shelf and stay on the shelf and don't get implemented. And of course, Transform Health and DCCC are trying to ensure that that does not happen. So I'd love to hear, obviously, everyone who's dialing in from all over the world for this conversation cares about this topic, wants to see data and digital technology actually help deliver on UHC. The question is, what can they do? Any final calls to action, pieces of advice, one thing each of us could do differently to ensure that these reports don't just stay on the shelf? And Danielle, we'll start with you.
Okay, sure. So after doing a report and getting that feedback, I think it's important to, one, present what you've gotten to the population that you surveyed, right? Help them understand what is the information that you found, and then you start to do some ideating to say, well, what are some of the possible solutions, or do you think that the solutions out of this report actually reflect the demographics or the bodies that you're representing? So I think it's important to move from, yes, this is the data that we've gotten, into what are the action points. Maybe you can put together a committee or a council or so on. But as Dickie said, and I want to reiterate, it's important to identify what perspectives that aren't being included and aren't at the table. And that may not always be young people. It might be, racial. It might be, there are many different minority groups that you can take this from as a perspective. When I look at the Caribbean, I see many digital solutions can be implemented, but you also have to look at internet penetration. That's not across the board. And if it is that you're trying to bring in the rural demographic, for example, like that's the demographic you're trying to increase access to healthcare for, and the response or the solution will be digital, then do they have digital devices? Do they have internet connection? Because typically that's where, there's a lower internet penetration rate. So I think it's important to identify what are the actual practical solutions, and you can never know that if you don't speak to the actual people that it will be affecting. So I think it's important that at all levels you're looking at all perspectives and moving it then from conception or the research that has been done to what will be done now going forward.
Thank you so much, Danielle. Couldn't agree more. Nicole, we'll go to you next. How do we, and when I say we, I mean the collective we, those we can't even see right here on our screen who are joining in from everywhere. How do we build on the recommendations of these commissions and ensure that the reports don't sit on the shelf?
Well, one of my favorite sayings is nothing is impossible, especially if it's inevitable. So digital transformation is happening, right? It's happening right now. What I would really like to make a call for action is don't let this be overtaken by one or two giants who are ahead of us and thinking of this. This should be inclusive, both in reaching everybody, the rich and the poor, but it also should be inclusive of companies and organizations that are already there right now on the ground, coming up with creative solutions. Don't wait until Google does it on your behalf. Be your own Google, and maybe even a better one. As a coalition, as a DCCC coalition, but also as a Transform Health coalition, we're here. We're creating this ecosystem. Come look us up. There's a website of Transform Health. There is an email address that is here in the back, I guess, of my screen. info@digitalcarecoalition.org, where you can send an email and reach out. Register there for our October 16th date, where we will have an introduction call where we explain much more about what it is, how you can join, what's in it for you, how you can help, how you can make this world better. And let's engage a discussion like this. And I think the only solution of making sure that these documents don't sit on the shelf is take action, and take action today.
Thanks, Nicole. And Dickie, back to you. What do you think we can all do?
Well, everybody has their own piece to bring, right? Catherine, if you don't mind, I'm going to go back to your very original question. What was the biggest barrier to digital transformation? And in that, one thing I didn't hear was local capacity. To me, that's the biggest barriers, the local capacity and capabilities in countries to really take, own, and drive digital transformation. And we need to support and address that. Many of you listening on to this discussion today have something to bring to that strengthened capacity. That is fantastic. It's really important to be able to step forward, take action. Joining today is a great first step. Beyond strengthening capacity, the committed leadership I talked about earlier, if you have strengthened capacity, technical capacity, if you have the committed leadership, and you have the financial resources. And so now I'm speaking to you donors and investors who are joining us today. If you can come together and align and really understand what it's going to take to accomplish digital transformation, these are all pieces to bring. I talked earlier about all the different communities that are together to access all of the different perspectives and opportunities. I encourage you to join. Come and join Transform Health as a coalition. If you're in the private sector, join Transform Health and the Digitally Connected Care Coalition. Find one of these collaboratives. Bring your piece. Bring your perspective. It is important. You have something that you can do that is going to significantly move the needle. And together, we're going to make it happen. So come, join us. Be a part.
Thanks so much. And thank you to all of our speakers. As a moderator, to me, what success looks like is that after spending an hour with us on your screens, you actually do something as a result of this conversation. It could just be send an email, sign up. But in my case, it's usually write a story. But I hope that everyone will do something as a result of this conversation, because as Dickie said, we each bring our piece when it comes to actually delivering on this question we talked about today. How do we harness the power of data and digital technology for health transformation in this COVID-19 recovery and beyond? So I want to thank Transform Health and DCCC for working with Devex to pull this event together. Thank you to all of our speakers. Thank you to our participants. You will get a recording of this webinar, so stay tuned for that. And with that, I'm going to go ahead and hand it back to my colleague, Vince, in Brussels.
Hi, Catherine. Just turning on my video.
Hey there.
Hey. Well, thanks very much for that. Did I detect a certain fatigue of a West Coast Devex reporter when you were discussing pilotitis? Is this a common?
Yes, indeed. In fact, I do appreciate the question that came in, but I reframed it from a yes or no question because I feel like I see in my coverage day to day, yes, it is a huge problem.
Yeah.
So how do we fix it? Yes.
It was really interesting to see that because, you know, as reporters, obviously we cover a lot the beginning of initiatives, and it's very interesting to talk about the next stage beyond that. I also like the comment about the data hub that Naveen was talking about, where putting procedures in place which will survive this crisis. I think that's something interesting that came out of the discussion as well, is, okay, we're all, especially in Europe, everyone's running around trying to react to the moment, perhaps not thinking as strategically as they could about whether the infrastructure and the initiatives are still going to be there in, 20 years' time or 15 years' time.
Exactly. I was also struck by this comment that fear has been a big driver, and what do we do when we have a vaccine, life feels a little bit more back to normal, and we don't have fear as a driver? How do we actually ensure this momentum continues? I thought that was really powerful.
Yeah. What kind of stories have you got coming up in the next little while, both around UNGA and perhaps on similar issues?
Yeah, I'd actually love to throw this out there because perhaps some of our participants would want to send a note my way. It relates to something Nicole mentioned when she was talking about one-size-fits-all solutions are not appropriate in the COVID-19 response, and that when you have countries just locking down left and right, it's possible that the actual response will kill more people than the virus itself. And so I've been talking with a lot of people about, that story's been told, the risk of the cure being worse than the disease. The story that I think hasn't been told, and back to this point of local capacity, is modeling. What is the role of modeling in helping countries navigate the epidemiological and economic way forward? And it looks different country by country. So I've been talking with a lot of groups working on modeling and building capacity for modeling in sub-Saharan Africa, just to better understand how do ministries of health and how do governments navigate the COVID response that makes sense for them. So that's a data-driven, tech-driven story that I'm working on. And if anyone's working on related issues, I'd love to hear about it.
Fantastic. Well, you know where to find Catherine on Twitter and through Devex. But thanks very much for a great session. And it now falls to me to close day 2 of the Universal Health Coverage Pavilion at the virtual Devex UN General Assembly spectacular that we've had both yesterday, today, and tomorrow. We have another event on mental health, which I think is something that has, perhaps we risked losing sight of, but in fact, certainly in my conversation, has been front of mind for lots of people about how you keep mental health on the radar when we talk about the response to COVID-19. So I'd like to thank again the partners for today. There's a lot of them, so you'll forgive me, audience, for not having memorized them all, but we do really appreciate our partners: Seed Global Health, Takeda, World Vision, Plan International, the Japanese Organization for International Cooperation in Family Planning, AstraZeneca, the Digital Connected Care Coalition, and Transform Health, and our overall partners, the United Global Mental Health, BD, MSD for Mothers, and Smile Train. And anything we're talking about, again, another call to our listeners, please, if you're sitting there, wherever you are in the world, looking at a computer or a digital device, please get in touch with us using the hashtag UHC Pavilion and all Devex homes, whether it be our homepage, whether it be Twitter, whether it be LinkedIn. We're really keen to insert your voice into these conversations as well. So thank you all for your time. I'll sign off now for today. And I'd also like to thank our behind the scenes team, Julie Espinosa and others, who've done a fantastic job this week, keeping all of this flowing, at least from where I sit in my bedroom in Brussels, pretty smoothly. So thanks very much.